Hey, welcome back to another episode of Red Pill versus Blue Pill. I hope you guys are doing well. My name is Dr. Delon Canterbury, CEO and founder of Geriatrics. And today we'll be sharing why senior care providers need to use pharmacists to save them time and money. So I hope you all are doing well. Hey, what's going on, Zach? Thanks for joining in. I hope you're doing good, man. Today, we are just talking more about the power of what pharmacists can do today and how you can use and leverage them for your senior care facility. So, unfortunately, there's a lot of misconceptions and misbeliefs about what pharmacists have to bring to the table. And so, people don't realize that you can literally be a deprescribing advocate and not have to be a trained medical doctor or pharmacist to make that happen. So, unfortunately, we simply don't use enough of pharmacists integrated into our healthcare system. So, this is something that I feel we need to passionately change by choosing the red pill and unleashing our potential as deprescribing advocates. So, using them can not only be integral, however, we can actually teach your staff, your team, how to be that advocate and focus on using this as a part of your healthcare intake process. Some people simply just don't see the reason for why we need to be on a campaign or crusade to stop harmful medication use in our seniors. And I say it again, unfortunately, we lose nearly 275,000 people each year due to mismanaged medications, okay? And so that equates to nearly $530 billion that we waste from our own taxpayers who spend money on patients that are, again, mismanaged in their meds and in their overall prescription regimen. So, I want that number to shrink. I want us to focus on reducing this use of antipsychotics, of inappropriate or potentially harmful medications in our seniors. And I know it's possible. It's possible when you have a team based approach and when you use systems in place to help you advocate for deprescribing. Another misbelief that I think some providers may see is that they simply don't see any revenue or benefit or potential in their profit margins in developing ways to reduce harmful medication use. And I can't tell you how wrong that belief is, especially when we're using your expertise to leverage deprescribing as a value added service and potentially as a way to grow your client and revenue stream because of the reputation you may have in holistically preventing harm in your patient's well-being. And when you start getting more clients with better outcomes, better patient satisfaction, you're going to get recognition in their healthcare community and you're going to get more referrals from providers who are seeing this value added service work with them. They also believe that you simply don't see a reason why deprescribing is even important or why this is a necessary thing to address. And again, people are not understanding that there is a cost, an indirect cost of not proactively putting in measures that can lead to you wasting some of your time and wasting some of your resources in treating mismanaged medications in patients. And so when those patients end up in more harm's way or may have an incident or health condition that's exacerbated, well, hey, unfortunately, if that hits you on the back end, if there's a fall, if there's just, again, an increased readmission rate or an ongoing issue in that patient's well being and mortality, then again, a dead patient is not going to make your business any revenue or any money. And again, I go to the extreme measure there, but patients that aren't doing well are going to cost the healthcare system more and indirectly can impact your resources, your time, and your bottom line if you're finding yourself trying to work with those that may not be best managed. So again, this is another way that people can leverage and work with a trained pharmacist and put them as a part of your business model. So again, we can reduce harm, save you time and cost, save the patient's time and cost, and better streamline the care that we sorely need in our fragmented system. So, what is this mindset, this medication mindset shift that I feel that we need to adopt to break free from this old way of thinking? Again, the medication mindset that needs to shift is seeing medications in our seniors as a last ditch effort when necessary. If we find lifestyle and other behavioral changes have not been addressed. Okay, we have to see that there can be more harm when it comes to our older citizens that just simply don't have the same body they used to have 30, 40 years ago. Their livers don't work the same, their kidneys work a little differently, and just how their overall body breaks down these medicines is completely different. So having this understanding in the back of our minds as we treat senior patients is critical to really seeing the impact of how deprescribing can play an important role. And so the medication mindset is the need to see the importance of holistically and completely treating patients and not just adding on another pill, adding to the prescription or prescribing cascade for problems that may have been prevented. So we have to change our medication mindset, one, to get people to see the power of this. Two, we need to start seeing healthcare as a proactive tool and system to advocate for our patients. We got to get out of our reactive way of thinking. We can't just keep letting people pass the buck in our seniors and allow them to continue with 10, 20 medications when you have a voice just as much as I do as a touch point in that patient's life to be that advocate and to be that empowerment source so patients can have the tools to make things happen if they want to translate or express concerns of getting off of certain meds with their providers. Again, we're not here to just tell people to stop a bunch of meds just because Delon said so. This is a movement, okay? This is a way of thinking where if you are a touch point to a senior patient, then the onus is on all of us to talk about ways to get off of unnecessary meds that aren't needed. So, this puts the other perspective into place where people assume you have to have, again, a medical license or degree to be an advocate, where we know first and foremost the patient is the CEO of everything. They're the CEO of their health. I wouldn't be here as a pharmacist if there isn't a patient. Doctors wouldn't be there. Nurses wouldn't be there if there's a patient at the center of our care. So if we know that they are honestly the CEO of everything in their health and wellness, then it's ultimately up to them to decide if they want to make a plan to get off of medications they don't see harm in. You know, it's easy to say, you know, work out, diet, exercise. But when you can carry that messaging with, hey, this can actually reduce XYZ amount of meds, or hey, this can actually reduce the need for you to take so many at once. You can actually consolidate or take off one if you do better with this one change. People are more incentivized to make that effort. I'm not saying it's going to always happen or be the one trick pony, but when you combine that messaging with the right trusted source as a part of the healthcare team, well then, hey, you can truly change behaviors. And that's where we talk about motivational interviewing in part of our series, as well as getting into the trust and development of having a shared decision process for the patient. So I will repeat it again. The patient is the CEO of their health and healthcare. So ultimately, if you can be that tool to help them kickstart their path to stopping meds they don't see or need, or at least have an open discussion and dialogue to question, then we're not doing our jobs. And that's what everyone's job is if you are seeing patients who may be in harm's way from overprescribing. Lastly, another limiting belief I feel is kind of holding providers back from jumping into the space of being a deprescribing advocate is they don't exactly see the pharmacist about ways to escape, about ways to reduce the medical or pill burden for their patients. They don't see them as a tool. Sometimes you kind of just have the same old picture of your pharmacist in a white coat, counting by fives behind a counter, putting your name on a bottle. And they don't quite realize that there are other pharmacists who work in so many different settings. There's just so many there's so much versatility to our profession. And so if you don't know that there's a tool available to you that can help show you how you can save money through cost avoidance, through patient empowerment, through really reduction of harm, when you're able to show that and track that, pharmacists can be a valuable tool in your deprescribing toolkit. So making sure you get real friendly with one, have a contract, you find a consultant pharmacist. We know that long-term care facilities have them, but man, there are few and far between for the thousands and hundreds of people that may be in independent living communities. We know that we have consultant pharmacists doing med chart reviews, they do audits, they do all they can, but they have tons of patients. Why aren't we seeing the pharmacists integrated into nursing homes? Why aren't we seeing pharmacists in adult daycare centers? Why aren't we seeing them doing med reviews? Basically, as an added service for caregiver support groups or other senior care facing advocacy programs. There are ways we can integrate into all of these models and provide invaluable service and show how our patients can save money and time with leveraging your personal friendly pharmacist. So again, we'll show you how to do all this as a part of our deprescribing accelerator, but we have to become fearlessly passionate about stopping harm in our seniors, okay? They're one of our most vulnerable populations. So are you willing to become fearlessly passionate to go the extra mile, to advocate, to be willing to integrate having a trained clinician into your business model to grow your revenue and really treat people where the problems arise? Is that a step you're willing to take? And again, this is whether you want to take that red pill or if you want to take that blue pill. Are you going to be fearless in this space? Do you want to be that patient advocate who passes the buck, or the one who that patient remembers because you caught a harmful medication error, or you were able to help catch a potentially harmful or life-threatening situation in someone who was over-medicated or maybe was on too many blood pressure meds? You have to be comfortable being that deprescribing advocate. And this is what I want as a part of this movement, this army of fearless providers who see the need for this and see the impact that pharmacists can have. So we talked about you becoming fearless. You got to be passionate. You have to take our broken healthcare system and put it on yourself. And we're going to do this as a team. We're going to show you how collaborating and using team-based approaches is what's necessary to move the needle in deprescribing. But what is available to you now? Again, you can leverage and work with your local pharmacist. You can become a deprescribing advocate. I've mentioned tools that you can start printing off today, more as using the Beers list, having an understanding of which medications your patients are on, seeing if they truly are understanding why they're on them, and then start asking, how long did they be on them? Again, when you have pharmacists showing the level of impact to not only push back against people taking 20 meds, but to also save the patient the money, they're going to come back to you and remember the service that you provide and how valuable that was for them. And guess what? They're going to tell their providers, they're going to tell their families, and that's going to lead to trust and brand and customer liability, or I'm sorry, customer loyalty that eventually leads to more revenue and more clients for you and your senior care facility. So the power is yours. Choose the red pill. Take the time to unleash your deprescribing potential. use the efforts available to collaborate with your local physician's offices, collaborate with your local outpatient clinic. Uh, don't feel like you're doing this in a silo. There are ways you could really, really revolutionize how we deliver healthcare and how we can use pharmacists to help your company grow and continue to save lives. This is Dr. Delon Canterbury. I want to thank you all for joining in for another episode of Red Pill versus Blue Pill. You guys stay safe, much love, and tune in next time where we discuss more tips that you can use to be a part of our deprescribing accelerator. You guys take care and have a great one.